Compassion Now Network for All, in short CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA. This is this week's breaking news in wellness and health for all people and for all professionals. Hi, I'm the Pete of Dr. Z and Pete. I'm the CEO of Bethel House of Refuge in Muhammad, Illinois. Formerly, I was the executive director of a prison ministry in this area, and previous to that, I was the owner-operator of a commercial construction business in East Central Illinois. This is my distinguished co-host and my good friend, Dr. Alex Rama Zachariah. Doc is a medical doctor as well as a medical professor. He was the dean of one of the top 12 medical schools in India, Christian Medical College in Ludhiana. It's out of 300 medical colleges. Doc and his wife, Prema, also a physician and medical professor, spent 43 years at Christian Medical College in Ludhiana, first as medical students, and then as faculty. They retired in the year 2000 from that position. Doc was a medical director at Provena, now Presence United Samaritan Medical Center in Danville, Illinois. He was there in 2008, 2009, retired from that, now living in Urbana, Illinois. Doc, you got a great resume, a lot of expertise, medical knowledge. I need for you to tell the people what we're about here.
Before that, we want you to hear from you about your wife and family.
Oh, wife and family. My wife, Stephanie, works at the University of Illinois as a travel specialist, and we reside in Farmer City, a little bucolic community to the west.
And this breaking news in wellness and health is for your information only, and do not change your treatment based on this info. You may ask your doctor to watch this or mention about this.
Yeah, get your doctor in here. That's what we need. Now listen, if you want to communicate with us, you can do it at via email. We've rolled into the 21st century. Email, breaking news at CNN4All.com. All right, we're going to jump right into our this week's program. HRT, hormone replacement therapy, says significantly improves muscle function down to the muscle fiber in postmenopausal women. That's your field of expertise.
Yes, a new study published from Uppsala University, Sweden, in the Journal of Physiology 2013, published over the last decades, have led to several negative reports that HI, hormone replacement therapy, may not be good for it. But this particular one has definitely shown that that it improves their muscle function down to the muscle level.
Well, that's what I heard, that the muscles of the human replacement therapy users showed a greater strength by generating higher maximum force compared to the non-HRT users. So there's some information on that. We're still checking on it.
Yes.
All right. The right amount of vitamin D for babies, 400 IUs, international units, is the dosage that's suggested. Vitamin D, right, crucial for healthy bone growth, especially in the first 12 months of their lives. Their bones, they're getting bigger quicker. So how much vitamin D, the question is, how much vitamin D should babies be given? What do you think, Doc?
This new study from the School of Dietetics and Human Nutrition at McGill University, Canada, published JAMA 2013. Just this month, last month. Sometimes a feeling that more is better. In France and Finland, the recommended daily dose is 1,000 international unit for infants. At the lower end of the scale, the Health Canada and WHO both recommend daily dose of 400 international unit.
Well, I think the researchers have concluded that the higher than 400 IU doesn't provide any additional benefits. So you're actually, the extra 600 IUs going down the drain. So 400 IU for them new babies. Okay, now we're going to move from babies to obesity. And what I've heard is obesity in the early 20s among young men really is a problem for them reaching middle age. I mean, like some of them aren't going to get there, right?
And this is not good news
No.
for those who are obese and
Yeah.
young. Yeah, the research published in the online journal BMJ, that's British Medical Journal Open 2013, the authors tracked the health of 6,500 Danish 22-year-old men for 33 years up to the age of 55. Almost half of those classified as obese at the age of 22 were diagnosed with diabetes, high blood pressure, heart attack, high blood pressure, not pleasure, blood clots in the legs or lungs, or had died before reaching the age of 55.
That means early age obesity is a big time no-no, because the older you get, the harder it gets to shed the extra pounds.
Right.
All right, we're going to move from weight to cigarettes, e-cigarettes. What should we know about e-cigarettes, Doc? They're becoming very, very popular, don't you know? You see a lot of them in public places, and they use like regular cigarette drops. So what do you think about those
Well,
things?
recently the Centers for Disease Control and Prevention, CDC, reported that e-cigarettes used by children doubled from 2011 to 2012. The health effects of e-cigarettes have not been effectively studied, and the ingredients have little or no regulation.
That's probably a definite plus for e-cigarette users. There is some short-term data suggesting that it might cause a little airway problem, but it's not the same as inhaling a cigarette. What I heard was Mayo Clinic isn't recommending e-cigarettes for people who want to stop smoking, so there's definitely a question mark in their minds at Mayo.
Absolutely.
You betcha. Well, that means get away from, don't think that
from any smoke.
That e-smoke is going to get you away from tobacco. Okay, we're going to move to vinyl flooring. Look out, Walmart. They said there's some harmful substance at schools and daycare centers. That's PVC, polyvinyl chloride. Large areas of vinyl flooring in daycare centers and schools appear to expose children to these
a substance.
these chemicals, compounds that are harmful.
Yes.
Scientists, they're reporting that. Let's see what do you think?
Yeah, the study from Seoul Medical Center Research Institute in South Korea, the result was published on the ubiquitous plastic ingredient in the American Cancer Society, Chemical Society Journal, Environmental Science and Toxicology, October 2013.
Well, what's this word?
This is the first study.
Yeah, that's the first study that verifies the chemical substance, phthalates, with XRF analyzer to evaluate the relationship between these substances and their concentrations in the PVC verified material. PVC is in a lot of floors in the United States. I mean, in commercial operations.
You were in construction, president of. Did you use a lot of it?
Lots. There's PVC. Look, in drain pipes, polyvinyl chloride. On most floors, flooring, if it's not terrazzo or carpet, normally in commercial applications of PVC. It's ease of care, long-lasting, all those things. So there needs to be more studies on the off-gassing and things like that. Don't just jump to conclusions and get paranoid. You bet.
Only a caution.
Yeah, we're just saying this is something to look into.
Yeah.
All right. Guess what? More obesity problems. Kids that watch TV and fast food advertising, it's associated with use, obesity. They're receptive to fast food advertising. They're bombarded with it, and it affects them.
Researchers found in a study published in the November issue of the American Journal of Preventive Medicine. The study found that the young people with obesity are significantly more likely to notice like the name brand in the fast food ads and they see on television than non-obese peers.
Oh, the link between youth obesity and receptiveness to TV fast food advertising held even when factors like snack foods and watching TV and sugary drink intake and the frequency of visits to fast food restaurants were accounted for. I mean, you can see kids, even in a store, if an ad comes on a television that's in a store, they're looking at it.
They're looking at it.
Yeah, absolutely. All right, we're moving from fast foods advertising to depression. There's a key link between intimate partner violence and food insecurity. That means they're going to be paranoid, they're going to get fat. Women who experience physical, mental, or sexual abuse at the hands of their partners have an increased likelihood of being food insecure. Now, that's a fancy name for I'm afraid to get fat, right?
Yes. A new study out of the University of Houston, Texas Obesity Research Center was published in the Journal of Women's Health, October 2013. The study found that the women experiencing intimate partner violence are more likely to be depressed.
Oh, my.
Which impacts their ability to ensure a food secure household for husband and children. Food security reflects rationing, portion control, and inability to offer families balance.
Boy, it gets to be a whole plethora of paranoia.
Yes.
Mothers who experienced intimate partner, notice they've changed it from spousal partner to intimate partner.
Yes.
Violence were at a 44% greater risk of experiencing depression and twice as likely to experience food insecurity or I'm going to get fat worries.
Yes.
You know, they put these fancy names on these things and they're really very simple and plain things.
Yes.
Okay, only 11% of children involved in bike accidents wear a helmet. Despite a California bike mandate, only 11% of LA County children that were treated for bike-related injuries were wearing helmets in spite of the law. That means law can't legislate smarts.
The abstract was presented October 22nd, the American Academy of Pediatrics National Conference and Exhibition Orlando. Specifically, children older than age 12 and low income and minority children were less likely to wear a bike helmet. Not that they can't afford it, it's not that expensive. And so...
Man.
Yeah.
Well, the CDC says, which is a Center for Prevention and Control of Disease, approximately 33 million children are riding bicycles with nearly 10 billion hours logged each year. My goodness. Unfortunately, bicycle crashes and bike-related injuries cause 150,000 emergency room visits. My goodness. And nearly 400 deaths each year.
Unnecessary.
Put your helmets on, kiddos.
Yes.
Okay, here we go. Doc, you know about this. Good cholesterol controls blood glucose, high-density lipoprotein cholesterol. That's the HDL called good cholesterol. Tends to improve blood glucose levels by enhancing skeletal muscle function and reducing adiposity, whatever that is.
Yeah, the scientists from Germany and Finland report in October 2013, American Heart Association journal Circulation, the prestigious, showed that a link for the first time that low LDL cholesterol with impaired use of glucose and burning of calories in type 2 diabetes.
Well, we definitely need our calories burnt. Yes. We're, as a nation, are becoming porkier by the day. Listen, we'd like to thank you all for watching us. We'll be right back, and I think that is Dr. Ross in the green room. You got him with us today.
Yes.
Okay, what we're going to do when we get back is we're going to have a panel discussion. So we'll be right back.
Alzheimer's disease, if left unchecked, will strike millions, including baby boomers, their children, and grandchildren in the coming years. As a scientist studying Alzheimer's disease for the American Health Assistance Foundation, I'm well aware that continued research is our only hope for finding a cure. Call 1-800-437-2423 or visit ahaf.org for free publications on Alzheimer's.
Compassion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, USA, presents this week's breaking news in wellness and health. Hi, I'm the Pete of Dr. Z and Pete. This is my distinguished guest and my co-host, Dr. Alex Raymond Zechariah, and with him, he has a guest, a more distinguished.
More distinguished? Of course, I'm not distinguished.
A more distinguished expert, Dr. Ross Yoha, MD, and we're inviting you to our panel discussion. How you doing, Dr. Ross?
Very good today. Good to be here again.
Well, it's good to have you here. We're going to jump right in.
It's always a pleasure to be with you.
Well, it's good. Now, I got a couple questions for you. Are you ready? You ready to roll?
Yeah, shoot.
Okay. I want to know if you think that exercise helps the elderly to prevent injuries from falls. What do you think about that? And also, just normal people, I mean regular middle-aged people, exercise keeps you from being injured, and elderly people from being injured when they fall. What do you think?
You are right on the dot. Yeah, just the appeared in D&J in October 2013. They have published that senior and non-senior exercise helps. And it helps to sort of, even when they fall, they found out their injuries are less, and even the number of fall is kind of less. Exercise more.
Ooh.
Tai Chi, gait balance. See, they can't walk, jog, run, elliptical. So they can do Tai Chi, gait and balance.
What, are you rewriting the song?
Yeah, exercise more. Tai Chi, gait balance. Endurance training till soaked in sweat.
All right, so we definitely got to be exercising out there, people. Exercise is going to do a whole lot more than just keep you trim.
Absolutely.
Okay.
Yeah, go ahead.
Cholesterol. I hear you're a cholesterol expert, and maybe even a more distinguished cholesterol expert. Is good cholesterol, is it good for anything else?
Yeah, good cholesterol is not only good for heart. Even a recent study, it is published in American Heart Association journals. Circulation.
Oh, really?
Yeah, circulation is one of the top journal in the world.
Yes.
Particularly related to heart. And so there is this latest issue has a publication that says that HDL, good cholesterol, improves muscle function down to the level of the fiber.
Really? HDL, that's high density lipoprotein?
That's correct. And exercise more.
Still exercising more.
Increase good cholesterol.
You changed it again.
Yeah, exercise more, increase good cholesterol. It helps in muscles even to fiber level.
Oh, my goodness, man, you're getting all over the page, Doc. All right, we're going to move from cholesterol to bike helmets. What do you think about kids wearing bike helmets? You think it's a necessity?
Oh, I think all children is wearing bike helmet.
No. Studies show that 89% of kids on bikes are not wearing helmets.
Really?
Yeah.
Oh, that is terrible.
Yeah, well, then you end up with all of these accidents. And 150,000 kids in treated for bike-related injuries, 400 dead annually, no helmet, head injuries.
I am shocked. What are the parents doing?
My grandson was riding a bike home from his piano lesson. He had a helmet on, and his wheel came off up over the front. The police found him knocked out in the middle of the road, and he had a concussion even with a bike helmet on.
He's absolutely, his brain was safe.
You bet. Well, all right, so you're a pro bike helmet guy, right?
Oh, certainly.
Absolutely.
100%.
All right, what about, we're going to go for the kids now, youth obesity. You see all these little porkers running around, and they say that it's connected to fast food advertising in print, on television, etc. What do you think?
Oh, that's right. There has been a recent article that these kids watches particularly notes all the brand and also where it is produced, and after that they head straight to that restaurant.
You bet. Man, Doc, I was noticing Saturday morning programming is loaded with this kind of trash advertising that gets the kids browbeating their parents to go, I want to go here, I want to go there, I want to eat this, I want to eat that. So definitely the study proved, or at least demonstrated, that advertising is one of the factors in child obesity. What do you think?
I totally agree. We need to they should have more sense, shouldn't they?
Well, the parents absolutely should. Even if it's on, doesn't mean you got to watch it. All right,
Yeah.
I got another one for you. E-cigarettes, they're exploding every place.
Just and then, talking on the eating thought. So eat more. Yes, eat more. Children eat more of veggies, fruits, whole grains, go nuts on nuts.
All right, you're back to the original. That's good. Kids, pay attention to Doc.
Eat more, eat less. Yes, eat less. Eat less of junk food that you see
On
in TV ads.
Yep. All right, man, this dude he's on it, isn't he?
Thank you.
I mean, he can really switch. All right, e-cigarettes, Doc. A lot of them every place. People are recognizing the problems with smoking in public places, the stigma, all of that stuff. Now they're doing this e-cigarettes. You see a little puff come out, and I want to know, what do you think?
Oh, cigarette is cigarette. You are not.
Okay.
So, Mayo Clinic has recently published that they don't recommend e-cigarette for kicking the habit.
Yep, that's what I saw. So you're in agreement with Mayo Clinic, right?
Absolutely.
Put you on the right page, Doc.
Yes.
All right, we're moving from that back to obesity.
Oh, good.
It's been suggested that if you're fat, porky, overweight, obese in your early 20s, it really is a dangerous place to be because that type of behavior and size and all that might even prevent you from getting to your 50s.
Yeah, you know what? That is kind of sad. When you look at all these children, you say, oh, they may not even reach the middle age.
Yeah, that's not good.
And recent publication has confirmed that, and you should be careful. Obesity is a disease.
Man, you are some songster.
Obesity is a disease. You know who classified obesity as a disease? American Medical Association.
I thought it was the insurance company.
Obesity is a disease? Yes. Now, it is called obesity is a disease. Diabetes made worse. Hypertension, stroke, heart attack. You must all treat ourselves.
Yes, you got to treat yourself. That means do your push-aways, get away from those things that you ought not to be eating, and shut off the television. I got one more for you, and this is referencing vitamin D in babies.
Yeah,
now,
go ahead. That's interesting.
400 IUs is what they suggest. I want to know what your thought, because in Europe, they're giving infants 1,000 IUs. What do you think is the result of that?
That's a waste. And, vitamin D is not as harmless. It can, too much also is not really good. So even WHO recommends 400 only.
400. And correct me if I'm wrong. Vitamin D is essential as a building block in the building of bones and bone structure in babies.
Yeah, you got it. Yours not.
Oh, yeah, maybe. Well, listen.
Yeah.
Hey, we got to run.
Yeah.
I think that you've answered our questions. We appreciate your participation, and we've seen another side of you in that you're very light on your feet with respect to your musical aptitude.
I appreciate that. It means a lot to me.
All right. Well, listen, Doc, thanks for being with us. We always appreciate you being with us, and we appreciate your plethora of information, your vast array of knowledge in the medical field.
Yeah, you can't get rid of me.
Yeah, I've been trying, but all right. Well, listen, we want to thank the people at Science Daily for the information that they've given us. We'd also want to thank the City of Urbana's UPTV production team. Their production coordinator, Jason Liggett, the one, the only, our personal production intern, Jacob Bernard, with his 3-camera expertise, our intern, Caleb Serpenis, and the UPTV station manager, Jake Schumacher. We thank the Chorister Fellowship, Tiruvala, Kerala, India, for the music score and the Hallelujah ending. And we want to thank you all for watching us. Thanks for being with us, Dr. Rama and Dr. Yoha. And
My pleasure.
Yes, we'll be back, and we'll see you next time.